Good morning, everybody. This is Dr. Murali Bharadwaj, your classmate, roommate, benchmate, tablemate in everyday preparation for NEETPG. How to consolidate your preparation in short sprints of 5 minutes is very important. I'll keep launching on this YouTube channel 5 minute quick short revision for the NEETPG. So what are the topics for today? 5 minute session. Allergic bronchopulmonary aspergillosis, cystic fibrosis, bronchial asthma, aspergilloma. These are some of the favorite areas of examiners. So what do you see on this radiograph? There are perihilar opacities and infiltrates and non-homogeneous infiltrates which are transient. They come and go in all the zones, typically seen in the case of the allergic bronchopulmonary aspergillosis. So how will be a MCQ in the tomorrow's NEETPG or FMG or NICET exam? A 35-year-old woman with a history of the asthma with 3-week history of worsening cough, breathlessness, thick brownish sputum, and she has multiple episodes of pneumonia in the past. There are bilateral pulmonary infiltrates, elevated serum IgE levels. IgE has increased to 1500. That's the reason it is called allergic bronchopulmonary aspergillosis. That means the body's immune system is reacting against the aspergillus. Positive skin prick test for aspergillus fumigatus. A prick test hota na? Prick test is mainly for prick test is mainly to test the type 1 hypersensitivity. Chest CT shows hyperattenuated mucus. So this is the diagnosis of allergic bronchopulmonary aspergillosis, which you need to be very sure about. Next, a 22-year-old recurrent episodes of wheezing, chest tightness, shortness of breath, especially in the night, and also early hours of the morning. And there is a dry cough, and it relieves by taking inhaler. No allergies, no smoking, expiratory wheezes are there, reversible. The word important is reversible. Asthma is reversible. Reversible airway obstruction classically defines bronchial asthma. Now, cystic fibrosis. 15-year-old boy. So you should know what examiner will ask. There are about 20,000 clinical vignettes which you need to know before you go to the NEETPG, INICET, FMGE exam, from which all the questions are going to come 100% sure shot. If you are not sure about these 20,000 clinical vignettes, then you have not even prepared, right? Now, cystic fibrosis. 15-year-old boy, recurrent respiratory infections, thick sputum. There is a bronchial obstruction, multiple episodes because of those viscid, thick secretions. There is pneumonia. Whenever there is any bronchial obstruction, obviously there is a pneumonia. And there are bilateral coarse crackles, elevated sweat chloride levels, and mutation of CFTR gene. This is how the cystic fibrosis typically clinically presents. So tomorrow in the NEETPG, you will be presented with this kind of ring shadow. Cups and cups and cups of sputum is produced by the patient. That's how the presentation will be. Of bronchiectasis. 45-year-old women, history of recurrent lower respiratory tract infection, chronic productive cough, exacerbation of the breathlessness, foul-smelling sputum, crackles, wheezes, and dilated bronchi with thickened walls. What is the diagnosis, doctor? Bronchiectasis. Dilated bronchi with thickened walls, are characteristic of bronchiectasis. Now, aspergilloma, a 50-year-old man with a history of TB, with chronic cough, weight loss, hemoptysis, episodes of pneumonia in the past, decreased breath sounds, and there is a cavitary lesion in the right upper lobe with a fungal ball. Aspergillus IgG is elevated. IgG is elevated, which is very classical of aspergilloma, chronic cavitary pulmonary aspergillosis. It is chronic. That's the reason it is the aspergillus IgG levels which are basically elevated is what you need to remember. So this is how our 5-minute revision, doctor. Please like this video, share this video, and also comment on this video. If you comment, the YouTube algorithm will make it viral, right? After the video is over, please do comment. And don't forget, rebrand.ly/NEETPG. You can click on that and become the part of the WhatsApp study group.